which will be going on at the same time. So your administrative review docs, the proof documents, will have them uploaded by the first of the month that was in this previous slide back here. So you can look at, just to backtrack real quick, you can look where you see your providers' names and the administrative review. We hope to get those documents in by the first of that month that you're scheduled in. And then for the second round of credentialing reviews, it will be in the same month, but we'll be reaching out to schedule that exact date to have those in by. And you can assume that it will likely be in the middle or towards the end of the month, granted everyone's schedule and availability, but hopefully to give you a little bit of cushion between those two dates. But for example, therapeutics, we see in August, have those files in by the first of the month for the administrative review, and then we'll reach out around that time to schedule when the credentialing files we would like in. And so back to the slide we were discussing, for the administrative review, we will be sending each provider a Smartsheet designated to them for them to upload files for the administrative review. As you can see right here where the blue arrow is, that's where a paper clip, you will see if you hover your mouse over it on the Smartsheet, a transparent paper clip will appear. That is where you will upload the designated files for that row, whether it is your risk management policy, the description of your recipient rights program, proof of the advisor training, and so on, and you'll upload it there. Also on this Smartsheet, if you look over to the column header on the right-hand side, there's a column that says provider staff assigned. We are going to be making you will be or are already editors in this Smartsheet for you to upload files to meet each row, each review document row fully, and to upload those files. You can change who is assigned per row, or if you want to keep the same person assigned for all of the administrative review docs, that's up to you, but we wanted to allow you to make that change depending on how this work is getting delegated on your end. I included on these next two slides the administrative review checklist, these slides here and here. This is simply a breakdown of the files that we expect to receive during the administrative review. And you can see they're broken down into, welcoming, trauma, accreditation, corporate compliance, and the factors that are associated with that grouping of files. This is what I will be using or referring to when I'm reviewing the files. So if you can check off every box on this list, you're sitting pretty for the administrative review, so you can feel fairly confident about that. And this file in a Word document form is also included in the meeting agenda that was sent out prior to this meeting. So I just wanted to include that on there, let you know what that looked like at a glance. Additionally, as we mentioned, not only are we doing the administrative review, we're also doing the second round of credentialing reviews. The files, or I guess you could say the practitioners that we will be reviewing this round, we will be including those names in your Smartsheet, looking something like this on this screenshot included. Mainly use this as a reference point for what is going to be included. We ask that you stick to only uploading the administrative review docs to the Smartsheet and continue emailing us the credentialing review docs as you've been doing. And that's more so because for privacy reasons and the documents that can or will be included in a credentialing review, we'll keep that off Smartsheet and more so for the time being over email still. And hopefully that makes sense and there's no confusion with that. For this round of the credentialing reviews, different from the first round this fiscal year, which was just NCQA standards, this round will be combining both NCQA and MDHS standards. And because of this, those names are included down below there. And if there are any questions with this process, let me know. And if Monica, if there is anything that you found that I may have missed with the credentialing review side of things that you want them to know going into it, speak now. Please let me know.
No, you covered it pretty well, and Thought I turned my camera on. Hi, everybody. Good to be here with some of you who have had the opportunity to do credentialing audits with me. Yep, so just be prepared with the names. It'll include the people that were giving you the opportunity to re-credential from last cycle, in addition to the ones that you have credentialed in that last cycle that are due to be looked at that didn't make that first round that we did. So we will have the list, in addition to the Smartsheet, will be included in the email. Again, another reference point, so you'll know exactly who you need to send over. And if there's any questions like, oh no, you have the credentialing date wrong, that they shouldn't be on this cycle, let us know. We can look into that and making sure that our lists are consistent with your records. But thanks, Richard, you covered it.
Thank you, I appreciate it. All right.
Richard, could I address one of the questions in the chat was about access to the Smartsheet?
Yes.
So we will be setting these up in the next week, and we will also contact you to make sure we have the right staff assigned to the different areas. So we'll also give you the ability to make those changes as you want. So we'll have a main contact person. You can set it up so you can add the email address of the staff that you would like assigned to each item.
Awesome, thank you. And do we have another hand raised? I wasn't sure. I see a hand up.
Yeah, I think it's me. This is Erica from Oakland Family Services.
Hi, Erica.
Hi. I just had a question. We, and I know it's probably just Easter Seals and I that are in this particular situation, but have clients kind of in both sides. So in substance use and then either in, SED or mental illness. And I'm wondering, for the credentialing specific, will it just be any of our staff? Because our staff actually don't do both. So we have staff that just do SUD, staff who just do SED. Will those be broken apart by credentialing typically, or will it literally just be any that we've credentialed that might fall into the reviews?
Richard, can I take this one?
Yeah, sure. Go ahead, Monica.
Okay, so it will be a combination of both. However, we are able to determine from that report where I capture the credentialing information if they are SUD staff or not. So for instance, for someone like OFS or Easter Seals, Richard will primarily focus on the SUD practitioners, as there seems to be fewer I'll just focus on you guys, OFS. He'll focus primarily on those, and then myself and another auditor, if needed, will focus on the core provider side of the practitioner. So we do have that separated out. Richard, I don't know if we decided if all would appear on the Smartsheet or if just the SUD ones, but the email will cover all of them, correct?
Okay.
Correct.
Okay, thank you.
Thanks,
Okay.
Monica.
Of course.
All right. So moving over to like Wendy said, we're also going to be discussing the ParF process versus the SUD credentialing Smartsheet process. I know we've discussed it. For some of you, that's how we've met thus far, as going through what's needed and different things like that along that process. So I wanted to just take this time with having everyone here to review it as well. I imagine you all have the link to access the ParF request form. If not, a hyperlink is included in here in the PowerPoint, which is sent out. And additionally, I don't want to waste anyone's time, but if anyone's interested in seeing how you can manually get through to the ParF request form through the website, I can show you that as well. Just let me know, and I'd be happy to do that right now. And if not, I'll move right along. All right.
I don't see any comments in the chat to request that.
So for just covering the basics of who should get a ParF request, and you are going to be wanting to look at all staff when they are hired, when they are terminated, or when changes are needed to their ODIN profile, whether that's adding a new license to their profile, giving them a new form of access, or maybe they're involved with a different location with the specific provider. That is when you would be submitting a ParF. The ParF form that you submit feeds information into a Smartsheet that will update that information and grant access. In addition to that, as you all know, with any ParF request, there is likely going to be supporting documentation required in the form. The documentation that is needed for specifically licensed practitioners, we're going to be looking for the staff's role in ODIN. What kind of access are they supposed to have, essentially? Their license credentials, license number, and the license issue dates, NPI number, and then the required attachments, which are listed here, but also the copy of license, their resume, background check, and McBAP certification. Now, it should be noted, if you are doing a modify existing request and you're simply giving them, a new form of access or updating which location they're at in their profile, you do not need to include these attachments. However, if they are getting a new license completely, as you can imagine, we'd want those proof documents just so we can be safe and follow all protocols when giving essentially a new form of access or allowed to be accessing certain information within ODIN. So again, modify existing and you're just changing access or location, no need to add those proof docs. But if you want to play it safe and not worry about it getting denied, of course, there you can simply submit everything, but hopefully it'll save you time by keeping in mind when you actually need to do so. Now, if the request does not include all information that's necessary, what will happen is I will deny the ParF request and include what's missing. Help desk will route that comment of mine to you so you know what to add, whether by sending it to me and saying, hey, I saw this got denied, or simply and ideally attaching it to the Smartsheet to the same request. That'll get routed back to me and I'll be able to approve it, no problem. Obviously, that adds a little extra time to approval, having to route it given our current process. So again, with the hopes of this presentation, again, we all want to deny as few PARFs as possible to get everyone access as soon as they can. Now, you may be thinking, with the PARF process involved, where the SUD Credentialing Smartsheet will come in, likely where you're going to be seeing it, and a way to avoid, I think, as much confusion as possible. I like to think as the Credentialing Smartsheet as where you'd go if you're updating a date, whether that is a credentialing decision date or a license renewal. Again, if you're adding a new license, that's going to require a PARF, but to make things, hopefully to make things as simple as possible, if you're going to be updating a date, chances are you're going to be doing that through this Credentialing Smartsheet. That's how we want to be going about it. And the only form of proof documents that are needed for the Credentialing Smartsheet, if you are updating a decision date, will just be that credentialing application that is applicable to that decision date that you're updating. Are there any questions related to either the ParF process or the SUD credentialing process? Okay. Now I'm going to pass it back to Wendy to discuss the Medicaid service verification process.
Okay, thank you, Richard. So we have been conducting the Medicaid service verification review for probably the last 3 years for SUD providers. And previously this was done by Crystal in the SUD team. So it's now transitioned over to the quality department. So for fiscal year 21, we're going to be looking at a sample of about 5 claims from each provider and review to ensure compliance with MSV indicators, which you see here on the screen. So there are 7 things that we really look for. We're going to pull a sample of the claims, and we're going to make sure that what was reported is a service that is authorized in the person's treatment plan, of course, and that we see documentation to support that claim in the record. We also are ensuring that whatever is documented to describe the service would match what is described in the Medicaid manual for that service. We also need to look closely whether the staff that performed the service was someone qualified and that it was within the scope of that person to do so. And then we look at the documentation closely just to ensure that it matches in amount, scope, and duration for what was submitted. So for fiscal year 21, We are going to look at assessments, which is what we've done in past years. And the real reason for that is because that's something that we do have access to in Odin in our electronic health record already. So it doesn't necessitate more work on any of you to supply us with additional documentation. So for now, that's what we're going to stick with, and that would be claims that are H0001. So for these reviews, any deficiencies that we find, and this is a requirement of MDHHS and the federal regulations, but if there are deficiencies, we need to recoup any of the funds that were paid out against that claim. So I don't think we've found problems in the past for SUD. So just wanted to make you aware of that. That's part of this review. Were there any questions regarding the MSV review? I don't see any. I'm getting some feedback, so if everyone could just make sure that you're muted, that would be great. Thank you. Okay, you can move to the next slide, Richard. Okay, I want to make mention of the attachment D. This is really something you'll be learning more about in the future because attachment D is going to be part of the new contracts for October 1st. But I just wanted to mention it because in each of the smart sheets you receive, there will be a section at the bottom that has a heading of attachment D, and we started to build those right into the same smart sheet. We're trying to eliminate having multiple smart sheets, so we thought this would simplify things. So for the time being, you can ignore that section, or if you choose to, you can start to utilize the smart sheet for this. So it will be a lot of the same documents that you've been required to submit before, such as satisfaction survey reports, any of the child referral reports, some of the things that happen per occurrence, like priority population waitlist reports, things like that, you'll see in the attachment D in the future. So you can begin to attach the documents, and this would take the place of all the email communication. So it would hopefully simplify just a mechanism and a central place to kind of store all that. And then the person at OCHN that has to review those documents would also be notified that you have uploaded that document so they could review it. So if you want to start utilizing it for that purpose, you can. If not, you'll hear more about that in future meetings as we discuss the contract more. Okay, and I will turn it over to Mike Daly to talk about orientation materials. Are there any questions? I'm sorry, any questions about the attachment D? Okay, all right, thank you.
Okay, thank you, Wendy. My name is Mike Daly, and I am the manager of customer services at OCHN. And part of our requirement with the contract with the state and with each of our service providers is to make sure that people have access to materials that relate to them as a beneficiary of Medicaid or a Medicaid enrollee. So this is in the contract that the contractor is responsible to make sure that the people they serve have access to information that is either provided by OCHN directly or information that you generate at your own agency. So as long as the things that are required of us, and meaning us as the provider network, is covered in your orientation procedures, we'll be all set. Today is to talk about the things that are the key elements that are to be included in orientation. You can set that up any way that you want. You can use our materials and as is. You can add your own materials to create a packet of information, if you will, for a person who's new to your agency. You may say, here's some information about our agency, here's some information about our staff, here's some information about what you do in urgent situations, maybe your agency's policy about after hour phone calls, those kind of things. So you can add to, you can do it separately. It's just as long as people have access to the information. So the information that we require are the recipient handbook, and sometimes it's called the services handbook. It is 60 pages that we have available at OCHN, already printed as a booklet, ready to go. And you can pick those up, or we can make sure we get them to you, hopefully not through mail, but we'll make sure we get them to you. In this COVID time, it's not as easy to have access to our building to pick up materials, but we do have to make sure you as providers have access to this information. So we have the recipient handbook, and we have to make sure that there's the contact information for OCHN customer service. And that is throughout the handbook. So it's not something separate. It's just that we ask that your team members or your employees, your staff, know about customer service. Any one of my staff are available if you want us to do a visit to your agency, talk about customer service and the role in our network. Customer service is in our contract with the state and also federal regulations for Medicaid, meaning that people receiving services from the public mental health system and SUD and intellectual and developmental disabilities have a place to go to ask questions, talk about concerns or issues, complaints, if you will, that are outside of the agency or the practitioner that is providing service. That the root of this comes from feedback over years that sometimes people are uncomfortable talking to the agency or the provider themselves about concerns when they're receiving services from that agency. So the federal Centers for Medicare and Medicaid had to set up a another place to go for people, and that's customer service. Sometimes it's called member service. And for you who have contracts with the Medicaid health plans, you have the similar information available to at Magellan or Meridian or Molina. Any of those agencies also are required to have a customer service or a member service line for people to contact if they have an issue of how services are provided. So to make sure that we are compliant, we make sure that people have access to the recipient handbook and the information for customer service. I mentioned that the handbook itself is available in print format that we take responsibility for. If it is easier for you to print that information from your own agency to include in your welcome packets, you're welcome to do that. And that handbook is available on the internet at our website, oaklandchn.org. You can also direct people to that website for that information. It's just, we have to make sure that we provide that information to people when they're first coming in to receive services from your agency. Any questions on that so far? Somebody have a question before we move to the next part? Okay.
I don't see any hands up or nothing in the chat.
Okay. The other part is that we do ask that staff have working knowledge of resources in the community, such as Social Security, the other side of DHHS for food stamps, and enrollment in other emergency situations that their worker at DHHS should be able to provide that information. We want to make sure that because all of us are supporting people with Medicaid, that they have access to information that's available to anyone in the community who have questions about specific services or entitlements. And you may all know about the Community Housing Network, which is a resource for housing, questions about assistance with housing expenses, roommates, etc. So we just want to make sure that everyone has access and are comfortable sharing that information with the people they serve. When in doubt, you can refer people with questions specifically to customer service at OCHN, and we will help assist people with that information gathering. So it's not 100% your responsibility, but it is something that we want you to feel comfortable talking to beneficiaries about. So this slide talks about the requirements for the confidentiality, but also further down, I think it talks about the handbook. There you go. Whoop, too far. That this one-page form can help cover everything. So you'll see that I am receiving Medicaid, Healthy Michigan funding, that if I'm receiving, I have information about my rights in the complaint and grievance process and local appeal, and that I have been given the customer services handbook. If you review this sheet with the people that you are serving and they sign it and you witness it, understanding in virtual world, if you sign on their behalf, because you say, I'm signing this on behalf because they're not available in person, then you're well covered for any audit that we might have to have from CMS or the department, that we indeed are following the federal regulations. Okay, so that is what the SUD orientation confirmation sheet is. The mental health side and on the intellectual developmental disability side, they have people sign that form and load it into Odin so that it's easy to us for access for an audit or a random review, just to make sure that people are indeed receiving the information. Any questions about that? And I believe that you have contact information so that you can contact me if you have any questions, even later on, something pops in your mind, or when you talk to staff, if they have questions, they certainly can reach out to me by phone call or email. I do see a hand raised.
Yes, I was just wondering, is it good practice to give this to clients who also may be coming in under Black Grant, meaning they don't have insurance? Just because I'm thinking many of our Black Grant clients sometimes do obtain Medicaid during the course of treatment with us. So is there any reason that you would foresee why we couldn't do that as a practice for our Black Grant clients as well as Medicaid?
That's a very good question. It's not required because the person does not have Medicaid when they're entering into your service. And they should be receiving, or they will receive, an information welcome packet, or a welcome letter, I should say, from OCHN. Anyone who's newly enrolled in Medicaid and receiving services from any of our provider network, they do receive a welcome letter from OCHN outlining this information as well. So that's pretty well covered. If you would like to do that information, just point out the availability of information on our website. And if people don't have access to the internet and they would like that information mailed to them, you can either provide that information to them or you can direct them to customer service. But yes, that would be very helpful if you're willing to do that.
Okay, sometimes it's just easier for us because there is a lot of back and forth, and then that way we're not just focusing on those who have Medicaid when they come in, when we're in, then we have to, I think, kind of backtrack and be sure that we can demonstrate that we did that at the time that they became eligible, and that may be harder to do than grabbing them at intake. So thank you.
Okay, thank you. Any
Mike,
other questions? Oh, yeah.
there is a question in the chat wondering if the SUT orientation should be uploaded into Odin.
I would like it to be uploaded in Odin as a document, but we haven't made it a requirement yet because not everyone on your staffs have access to Odin yet. So we're trying to figure out a way to make it least burdensome to your agencies. If you have, because once it's a paper, so you're going to be filing that paper somewhere. So if it came to question, did you indeed provide this information and that orientation checklist or that statement, that as long as we have access to it and you can produce it, that's fine. But perhaps in the future we will have it loaded in Odin as a requirement, but not at this point.
And we have a hand up from Scott. Did you have a question?
I did real quick. So you're saying the SUD orientation confirmation covers all the requirements for orientation, or just the recipient rights and I think confidentiality?
Yes, and the handbook.
So if we have them sign that, then we're all set for all the requirements you were talking about from customer service regarding orientation?
That's correct.
Okay, thank you.
I see Sherry's hand up. Did you have a question or comment?
Yes, I have a comment. Good morning, everyone. To Erica's point, we do want the form used for block grant individuals as well. As Scott stated, on the document, it covers recipient rights and it covers 42 CFR, and everyone that is a funded OCHN individual has to have that information.
Okay, thank you.
Yeah, thank you, Sherry.
All right. Now, were there any other questions at all for any part of the presentation thus far? Anything that I, Monica, Wendy, or Mike or myself might have missed?
I had an other that I missed.
Oh, go ahead, Monica.
If I can just chime in.
Yeah.
So I should have brought this up during when we were talking about credentialing a bit. So I know many of you are updating your standard credentialing policies to reflect some of the things that we talked about in that audit tool about, capturing some of the language that OCHN's policy covers about primary source verifications and your credentialing committee. So some of those basic ones, I know you guys are working hard on updating those and we look forward to seeing them. With that being said, NCQA released their new standards, and as we were navigating through, there is a new requirement for a credentialing policy. This is going to be separate and apart from the one you're currently working on. It's really going to be surrounding safeguarding your credentialing information. Who has access to these credentialing files? What happens if you need to modify something for a particular reason regarding a credentialed file? That is on the horizon. Because we know this was a lot of information to take in today, we didn't want to move forward with rolling it out. We are actually finalizing it from OCHN's policy. It's going to our executive leadership right now for review. We are hoping to be able to present that to you at May's directors meeting. So myself or Marquita will be presenting on that new policy, and that will be required. We'll talk about the rollout and how long that'll take you guys to complete that. But the great news is OCHN's policy will be finalized by then. And I just want to reassure you that anything that we ever give you, you can use. So you can copy our language and use that tool to get this policy done quickly and efficiently to how it's needed. Just wanted to make sure everyone was aware that this is on the horizon. And I know I've already asked a lot of you guys with re-credentialing files and the credentialing policy updates. So this one is on the horizon, but we'll give you a little bit of time to get that done. So I look forward to talking with you guys more about it in May.
Wonderful. Thank you, Monica. And Wendy, anything final you wanted to review before we concluded today's meeting?
No, if there are no other questions, I wanted to make sure everyone had an opportunity to ask questions, or you can always feel free to email anyone on the panel with your questions as well. And we really appreciate you being here today, and we look forward to working with everyone. So if there's nothing else, I guess we can conclude the meeting then. All right.
All right. Have a great day, everyone.
Thank you so much.
Thanks, everybody.
Take care.
Bye.
Bye.